put you directly on the hot seat.
That's the hot seat, is it?
You could be in the hot seat. Like me.
Hey, that's right. What's up, all my hangers out there? Welcome back
To the hot seat.
or should I say, welcome back home. Because you know what happens when you come here. You know, you're at home. You're just hanging out with your friends. And you know how we do. We just get together and we talk and we share and we laugh. We even cry sometimes. You know what I mean? You know how we do. I got to say, I am extremely excited today. The reason being is because we haven't had in-house studio guests in a while. That was Toby Dykes. You know, he came in, shared his story, got real deep, you know, got real personal. Basically, you know, he just turned tragedy into triumph. He basically went from jail to swell, you know, told us his lowest points in his life and how they, you know, through the grace of God, turned into the highest points of his life right now. All right. So y'all know how we do here. We all family. It's all love. We all share. And we just sit here and fellowship together. All right. So for me, I'm very excited because 1 year later, we're back at it again. And I have the extreme honor of introducing our guest for today. And that is Tracy McClain. All right. And she's going to be here, and she's our authority on mental health awareness, you know, being that she has her own personal experiences and struggles with this subject. So without further ado, let me introduce Miss Tracy McClain. All right. So, Miss Tracy McClain, how are you doing today?
I'm doing well, thank you.
Awesome. As I was telling our audience that you have some experience with this here, this subject on mental health awareness. Mm-hmm. First of all, let me say thank you for taking your time to come out here, because it's not like this is around the corner from you. So I definitely appreciate you coming out to the studio to share your experience with us. Before we jump into it, I want to set this up for all our audiences out there that are listening. First of all, so guys, we took a 6-month hiatus, okay? And when we did, we came back in May. And when we came back in May, it was right around the time of Mother's Day. So we came back on the Mother's Day show. And right after that, we just didn't have enough time to actually delve into it. But May is technically the Mental Health Awareness Month. But because we felt like we owe that to our audience to cover this, we're bringing that back in July, which just so happens to be the National Disability Act Day is July 26th. So it kind of just ties all into this. All right. National Disability Independence Day on July 26th commemorates the signing of the Americans with Disabilities Act, ADA, on July 26, 1990. The day not only celebrates the anniversary of the ADA, but it also serves as a way to bring awareness and break down barriers individuals with disabilities face every day. So, as I was saying, we're here for mental health awareness. Okay. Mm-hmm. Now, according to WHO.int, which we know WHO stands for World Health Organization, mental health disorders such as depression or anxiety affect the way we think, feel, and behave. There are more than 200 types of mental illnesses. Symptoms of mental health disorders usually improve with treatment, which may include medication, psychotherapy, alternative therapies, or brain stimulation therapy. 8 most common types of mental health: anxiety disorders, depression, bipolar disorder, post-traumatic stress disorder, as we know as PTSD, schizophrenia, eating disorders, disruptive behavior, dissocial disorders, and neurodevelopmental disorders. So, Ms. Tracy McClain.
Yes, sir.
We would like to start off by introducing you to everyone and letting everyone know a little bit about you. Mm-hmm. So if you don't mind, ma'am, can you just tell us, me and the audience, a little bit about you?
Sure. Howdy, everybody. I'm Tracy McClain, and I am a registered nurse. Well, first caveat, I am from Northern California, been in the South for 35 years, and I have allergy issues. So if you hear my voice ebbing and flowing, that's why, because I'm battling allergies.
That's okay. Now I want to ask you something real quick because I mean I don't know if this resonates with anybody else, but if I hear McClain, you know, the first thing I'm thinking of John McClain. I mean, you wouldn't have to be related to.
Yeah, that's my uncle. That's what I tell everybody. That's my uncle. Yes.
That's right. So if y'all hear yippee ki yay mother, all right. So y'all know what it is. All right.
So, so I've been in Texas, well, for a while now, over 35 years. I'm a registered nurse. I have my bachelor's in nursing, and I'm also a legal nurse consultant. And I've worked a lot with mental illness. And it was, I worked at the state hospital for years, and it was really amazing for me to work there and see folks come in. People would come into the hospital and didn't know who they were, and having all type of auditory visual hallucination. Once they were put on the correct medication, then you would see just blossom a whole new person. And I never once thought that I would be in a position to have someone in my family, be it my middle child, to be diagnosed with the mental illness. But I am your quintessential grandma. I have 6 grandchildren, 5 children. Okay. And as I said before, I'm an RN, BSN, legal nurse consultant. Been doing that for about 30 years now.
Did you say RSBSN?
Oh, well, I'm sorry. The way that it goes is I became an RN first. I was a 2-year RN, and then decided that I was being left behind, so I went back to get my BSN, 4-year bachelor's degree. And when I finished that, I decided that I wanted to move into legal nursing. And so I went on and got training to become a legal nurse consultant. And I ended my career at the Attorney General's office in tort litigation.
Oh.
I have a little bit of a background.
Yeah, you do. Yes, you do. Okay, you're throwing out these acronyms and designations and stuff. Like, hold on. Okay, so for the people that are not up on this game here, can you tell us what RN stands for?
Registered nurse.
Okay, so you guys got that. If you meet anybody and they say, "Hey, I'm an RN," you know, you're a registered nurse. Okay, I know. I heard that on the podcast. I got you. And then a BSN.
A bachelor's in science and nursing.
Wow. Okay. All right. Now I'm gonna be honest with you. I've heard RNs and the other ones, but BSN, that's my very first time hearing about that. To be honest with you, so you just put me up on some game. So next time I hear somebody say BS, I'm not gonna think they bull essing a bull essing nurse over here. All right. So this is real deal, y'all. All right, cool. And I heard you say you had some kids and some grandkids and everything. So shout out to the grandkids, the kids out there. You know.
Too many.
Yeah, y'all see mama out here doing her thing, right? She representing. Okay.
Right.
Okay. So now, how many of your kids? Because I know that we shared some of this before we got started. How many of your kids deal with mental health issues at this moment?
5 children. I have, I would say, 3. One is just really spoiled. That's the baby. And,
so ain't nothing wrong with you. No, you quit playing.
Just 4. You know who he is. And so, of the 3. But also as a caveat, I have to say that these children are also Gulf War kids.
Okay.
When my ex-husband came back from Saudi, we were told not to have children for 5 years, which of course it was a big baby boom after that conflict. And these kids have they're functioning, they work, they all have, their degrees, because I wasn't going to take care of them. And, but they had some issues that we noticed along the way. And we are attributing that to the Gulf War syndrome. And they're still doing studies. They're trying to tell us that's not so. But there are a lot of soldiers whose children are suffering from mental illness and other disorders.
And what is that terminology again you're saying? Is it said Gulf War?
Gulf War syndrome.
Say Gulf War? Okay, Gulf War. Okay.
Yes.
Okay, and I definitely have heard of that. I hadn't met anyone that actually was personally dealing with that. So this is very interesting to me, especially being that we are so close to Fort Hood, right?
Yes.
Cavazos. Yes. So, so for anyone that's out there that's dealing with that, that is interested, like right now, this is piquing your interest. If you want to leave something in the comments, I'm pretty sure that our guests would not mind, going into this a little bit further with you. So please leave maybe your information in the comments or maybe some questions, and we can bring some answers back for you. Okay, so these are your personal fights with mental health so far, right? Is it kids, or does it go a little further? Like, is like background history with your family?
We do have a background history, and from what I understand, especially with say the disorder schizophrenia, it can skip a generation, and I do know that there was a history on my grandmother's side and also my ex-husband's side, and so we never thought about it. That basically we didn't. We're living day to day, taking kids to school, to sports. Never thought about it until it affected this middle boy. So I'd also like to add that my experience in nursing is varied. I did not want to become not just a hospital nurse, but for me, I liked variation. So not only did I work at the Austin State Hospital, I was at the Austin State School. So I was working with people that had some mental retardation. And then I worked at the prison. I was a prison nurse. They ate me alive because
For all my prison workers out there, hey, CBR, I've heard about the stories there.
yes, and they are all true.
Do you have any stories that you want to throw out there?
Oh, my
Anything
word.
you experienced?
Okay, as the RN, not only did I give the medication, I did med call,
Okay.
which means the guys would come and say, "Hey, I'm sick. I need to see the nurse." So
Really?
yeah.
Oh, I'm sure you got that all the time. Because for those who can't see her right now, let me just tell you, she's a very nice looking woman. And so, yeah, I'm pretty sure that was a nurse call all the time. Hey, nurse, I got a splinter in my finger. Like, boy, if you don't go ahead somewhere.
Yes, I did a lot of that.
wow.
But my call box stayed full,
Mm-hmm.
and so I would get all the guys would come in. It was from foot problems to somebody sat on my bed and they left a critter on my bed and different things like that. Can you check me to catch it?
They like, my neck ain't my back. They just making up stuff, huh?
All of that. And I'm like, I'm not catching nothing on your body. You better go get it yourself and bring it to me. And so I learned to curse in the prison because I didn't curse at first.
Wow.
But I was cursed out so many times because what I was doing was I was groomed initially as a Motorola nurse.
Okay.
So I was Motorola customer service global.
Sure.
And I brought that to the prison.
Okay.
So, and
Wow.
they learned me a lot.
Right.
I grew up when I worked at Del Valley in the
Okay.
tower.
So y'all see what y'all did to her. She was all sweet and innocent and everything like that. Look what you did. Look what you did to Tracy.
Ruined me.
She really was like, yippee-ki-yay, mother. Yeah, okay, so, and how long did you do that again?
I did that for about 2 years.
2 years.
It became too much.
Right.
And then I got pregnant with my youngest, Tracy.
Okay.
And I had to stop. It was just too much. It was I think the last place was in Bartlett, CC.
Okay. Okay.
Something Corporations of America was my last for prison nursing, before I went on and decided to do occupational health. So I was at Cisco Foods.
Okay.
And I was their nurse there for the longest, for about 6-7 years.
Wow, and Cisco Foods too? Okay.
Yes, I was a nurse there. Like I said, I like variety. So I moved
Yeah.
around a lot just
Yeah.
for the experiences of it, just to say as a nurse, you don't have to stay in one place. You're
Absolutely.
not bound to be in one place, you know.
Absolutely.
Broaden your horizons. And that's what I did during my career. And I ended as a legal nurse consultant, like I said, at the Attorney General's office.
Wow.
And I got the corner office on the 12th floor.
Oh, y'all hear that? Okay, okay.
Made it.
Hey, put some respect on her name. All three of y'all. So,
I did that.
okay. So that's where you are now, currently.
No, I'm not there currently. Unfortunately, I was in a hit and run accident that ended my career. But I still try to be a servant leader, where if there's a new nurse coming up and I have information, I pass that on.
That's awesome.
Because it's a legacy thing.
That's
awesome.
awesome.
So I pass the baton. If there's any little tips I can give, I do that. Because even if I give something to someone and they move beyond me, that's my purpose. That's what I'm supposed to do.
I love what you said there, because you said my favorite word, and that's legacy. I'm all about leaving a legacy. Y'all know how we talk here on this podcast. You have to leave a legacy. What do you want people to say about you when you're no longer here? You know what I mean? And things that you've done already sounds like there are some people who hold that information dear to their hearts. That no, I got this from Tracy, you know what I mean, or Miss McClain, or Nurse McClain, or whatever they call you. They know where it came from, and that's your legacy, as well as your kids. Your kids are your legacy. You know what I mean? So I love that. Okay, so here's the thing for me. I've always, if I run into a nurse, it's usually the how do you say this? The ones that the home care.
Home health.
Home, yes. Okay, those are the ones I usually run into if I run into a nurse. You understand what I'm saying? Do you have any experience with that as well, or?
I was just sharing with Timmy an experience that I had as a home health nurse.
Okay.
I was a young nurse, about 24.
Okay.
And I was sent out, way out yonder to the country.
Sure.
And there were no cell phones, so we used pagers at that time. So I went out.
We showing our age around this thing. Ain't we? Pages.
Sorry, y'all had a pager. And so the office sent me out to see this one client. And I went out there. It was an old house, wraparound porch. And went in, and I'll never forget this. The mom was like, "Oh, come on in, honey." And I said,
Okay.
So I go in there, and then I see the wall, and there's like toys nailed against the wall.
Whoa.
And there's a pallet, and I'm like, I'm gonna die, because I was way out.
Right.
I was afraid.
Ooh, sound like some Texas massacre with chainsaw massacre type stuff.
And,
Oh my
and
God.
please, God forgive me, I'm not talking about anyone with a disability, but
Sure.
my client that came in, he crawled in. And his skin it kept him inside, and his skin was so pale. And I noticed in the corner there was a crib, but it was more like a cage.
Wow.
So evidently, maybe he crawled out at night.
Are you serious?
Crawled on me. Yeah, he crawled on me.
Whoa. Hold on, that Tracy. You about to give us the G Willikers in here, man.
This
Ooh.
is real talk. It happened. And I was
Wow.
a kid, and I was afraid, but I had to still be professional.
Sure.
That was my client. I was there to serve him. I was
Right.
there to see what he needed, what
Absolutely.
type of care. So I went ahead and got the information from the mom while he pinched me and touched me. And
Wow. Oh my goodness. Oh, that sounds. You're making me nervous now. Like, oh.
I was afraid, but by the grace of God, I made it out.
Absolutely.
Everything went good, but that's one story that I will never forget.
Wow.
Just him crawling on me.
Oh my gosh. That stuff of nightmares right there. But you know
it's
what?
Experience.
I'm sure all of that, along with everything you've gone through before and after, has built you, built up to the person you are, built your character, made you strong. Yeah. Yeah. And guys, listen, for any of you nurses out there that's listening, please, if you got some stories that you'd like to share with the Hangout, please leave them in the comments. Okay.
Yes.
So let's dive into what you're going through personally with your son.
My son. Yeah, he's not happy about this, but like I explained to him, this is my story, not his.
Yes.
When he's ready to tell his story, he's perfectly welcome to come out.
Okay.
But I feel like me being his advocate and I have a voice.
Yes.
And I've been trying to get my voice out for the longest, not only for me, but for other people that are going through this and experiencing this.
Absolutely.
And who's lost hope.
Right.
Because I know there's so many times I lost hope and I just didn't know what to do. I cried, and then I got a hold of Kim, keep it moving.
Oh,
And
okay.
I just got up and just went on the next day, because that's all you can do when you have someone that you love that's mentally ill.
Right.
So if there's time, I can get on into his story. Sorry about everybody about my voice.
No, it's fine. Listen, guys, y'all know this is Austin. There are allergies all about. Okay. We thank you that you still came out to do this and everything like that. So we're just fine. So I know we'll give a shout out to your son, and let me just say, man, your mother is extremely brave for doing this. This is not a personal attack against you or anything that you're going through. But for her mental, health as well, this is something that she needs to get out, because as we know, pressure will bust a pipe. You can't keep this stuff bottled in. That's the problem with a lot of people. They keep it bottled in. They're afraid to share it. They're afraid that people are going to laugh at them, and not realizing there's so many people that are going through the same thing that you're going through, and they need someone to champion for them.
Yes.
And right now we have a brave person that's in here championing for you all. All right. So we're gonna actually congratulate your mother. You know what I'm saying? And we're gonna definitely applaud her her bravado right now. So again, Tracy, thank you. Okay, so more about your son and what he's going through.
First,
What you guys are going through,
I
actually.
want to say thank you for giving me the opportunity to tell his story. I've written so many different, he's a Morehouse man, so we're going to put that out first.
Hey, I'm from ATL, shawty, so you know what I'm saying. That Morehouse man, come on, bro. Hey, Rob, what's up, dog? You know what I mean? I know you know what it is over there by Ashford and Simpson.
Yeah.
You know what I mean? That's old stomping grounds. You know what I'm talking about over there by Clark, Atlanta University, Spelman.
That's it.
Hey, Morris Brown, man. Come on, man. This ATL up in here. So it's all love here. It's all love. All right. So I'm sorry.
Oh, no, that's fine. You got to
Gotta represent for the city.
Home. Yeah, you got to talk about home.
All right.
So he is initially, his name is John Robert. We call him Ra. And his name is Ra because he is the son. We know that's the God,
Yes.
Ra Horus, the son. So when I saw him, I said, that's Ra. I knew right away that he was going to do great things. And he is a brilliant, brilliant child. So to have to go through this with him, I'm not ever going to give up on him. You know, he's most like me. And we always tease as far as our GPA. But I'll get into that in a little bit.
Okay.
So Rob went to Round Rock High, graduated 2014. He was an AB student, you know, kind of fooling around, not really wanting to do his schoolwork. Like most kids, you got to stay on them, get on them. I was a single parent, divorced by then. I think I was divorced probably about 5 years by then. So I had 5 kids in the house, and I was on my own working full time. So I had to keep on them. So he was quiet, the middle kid. Always a good kid. I worked at Cisco Foods, and so he would like to get the extra candy and hustle it out to put money in his pocket.
Hey, that's right. I used to sell candy back in the day, Mama. You didn't know that, but I used to sell candy at school.
So when he graduated from Round Rock in 2000, and it's so many of them, I had to keep count of which one is this one. In 2012, he wanted to go to my ex-husband's alma mater, which is Payne College. I think that's in Augusta.
Okay.
So his dad graduated from Augusta. He's an Omega. And
Now, is he from Georgia? His dad's from Georgia?
he's from Americus, Georgia.
Okay.
Yeah, small.
I know America's. I know country town. Hey, man. GA up in this thing. Okay.
So he went to Payne, and he didn't really care for Payne, I guess because Round Rock had this, at the time they were accelerated, so their classes were a little different. And he said that he felt like he was in the 13th grade.
Wow.
It was so different. It was a culture shock coming from Texas
Sure.
and the curriculum, and then going to Georgia to that school. So he came home, I believe it was summer of 14, and then he decided, we talked about Morehouse, we talked about Howard University. He had the GPA to get into either. I wouldn't go to Harvard,
Of course.
but he decided to go to Morehouse because it was closer to Dad.
Right.
You know, you always have family there.
Right.
So he went off to Morehouse in 2014.
Okay.
And away from home, you know, calling me. I'm like, boy, get out there and meet some pretty little girls. Stop talking to me. Get off the phone, go and have fun.
Sure.
But he kind of felt a little different because they used to call him Texas.
Okay.
Because he wasn't from that area.
Sure.
So he got in.
I'm not to interrupt you, but I want to say that anyone that's not from Texas or haven't really been to Texas, for some reason they still think there's like horse and buggies and, you know what I'm saying? You know, it's just really country here and everything. And even to this day, people will still think that if they haven't been to Texas. And I'm gonna tell y'all, that's not the case. Okay. Now, granted, I was downtown Austin the other day and I saw someone riding on their horse. You know what I mean? That's what they do, but it's not just horse and buggies and stagecoaches. Come on, that's the 1800s. Come on. But no, that's cool. I think that's actually kind of funny.
So, yeah, that's what I thought when I came from California, too.
Yeah.
That but it's not nothing. They're metropolitan, you know, they're up and coming, especially in this Round Rock area.
Absolutely.
But back to Ross. So went to Morehouse, did fairly well. He was trying to achieve a 4.1 like my 4.0.
She had to throw it out there, then she raw. She's like,
I had to do it. And so anyway, doing his studies, was a part of the chess club, was a part of the Black Student Union, different things like that, was really becoming involved. Well, unfortunately, one night, he decided to go to the basketball court to play. And he was playing with guys from the neighborhood. And how can I explain it? That Morehouse is kind of like in the area, it's not Round Rock.
oh, I know.
It's the hood.
It's the hood.
It's like where I come from.
It's the hood.
And
Oh,
he-
yeah.
And he's a Round Rock kid, so he didn't quite understand the dynamics of it, what you can and cannot do. So evidently, he said that he played a basketball game. He won 21. And some dude said to him, no, we don't play it like that here. And he told the guy, he had a vast vocabulary. However he said it, the guy became offended. He was an adult, black on black.
Yep.
And he said, oh, and this is the kiss of death for someone who is intelligent. Oh, you think you smart.
Yep.
And when you hear that, you know it's about to go down.
Oh, yeah.
It's going to throw down.
Yeah, because you're basically talking over their head. They don't have anything else to fight with, so the only thing they know is to fight physically, or you know what I mean, to come with some negativity. Because for the other people that's around them that actually do know what they're talking about, you know what I'm saying. Unfortunately, they're not brave enough to say, "Hey, man, chill out. Nah, he didn't mean it like that," and so forth and so on. And unfortunately, sometimes we want to see that black on black, so we want to see a fight. We egg it on, you know what I mean? And it's quite unfortunate, but yeah, I know exactly what you're talking
That's
about.
what happened. And then the guy attacked him, beat his head into the ground. And I was just blessed that the other fella's friend was there.
Right.
And Ross said he remembered him saying, man, leave that kid alone.
Right.
Leave him alone. And that's how he got up and went back to his dorm or his apartment he was sharing with a roommate. And when I saw the pictures, it was like, I have a pig. It looked deformed. I know my daughters were screaming downstairs. I'm like, what are y'all yelling at? Stop all that noise. I got to go to work.
Right.
And they showed me a picture, and it was just, I couldn't believe it. So, yeah, right after that, that's when we started seeing some changes. And I actually believe that he suffered more from mild traumatic brain injury as opposed to the schizophrenia. But it was so much confusion at the time. My ex-husband, wanted him to get back to school, because to him it's just like a street fight.
Sure.
To me, I knew it was more.
Sure.
So I got him back there, and that's when things started to unwind. But Rob, being who he is, determined, he got a full-time job, and he went to school full-time to keep his mind occupied. So after all of that happened to him, he went back, and that happened in 15. So he went back in 2016, and he graduated cum laude.
Oh,
So
wow.
he graduated
Congratulations.
3.8. Yeah, so he did that thing. He did that.
See, she had to throw the numbers, didn't she, Ross? She just had to do it. Didn't she?
Not
So
a
two less than you, huh?
Not a 4.0 like your mama, but close enough. You know.
So you didn't get it from your mama. No, I'm just playing. But listen, no, he got it, man. So I just want to make sure we're clear. Me and the audience is clear. He was fine until that fight,
Exactly.
which means, and let me point this out.
Yes.
That's why we have to stop the violence. Use your words.
Yes.
Okay, that could have turned out completely different. And violence is violence against any person, whatever. But it's so sad when it continues to be black on black. It is so sad because we talk unity, we get upset when another race does anything to us or whatever, but we don't highlight it when we're doing it to ourselves for some reason.
That's true.
It's just
That's
unfortunate.
So true.
Okay. So now we are getting into the experiences you've had since that has happened.
Since that has
What
happened
changed in his life? What changed in your life?
in my life, I became as I said before, there's a term that I learned from being a military wife. I have always been, since that happened to him and he came back home. He got back home in 18. But let me go back, because after that happened, he graduated, was doing okay. I went down for the graduation, but when we left, he had a look. It was a longing, because all the kids, all the brothers and sisters and everybody was there to support him. But we left, and I saw this look in his eye, and it was a longing, and I didn't feel right about it. And then shortly after that, I received a phone call that he had went back to campus and was trying to go eat at the lunchroom, and a woman was talking to him and touching on him, and he slapped her in her mouth.
Whoa.
Yes, 'cause she asked him what was he gonna do with his degree, and he said, "I'm gonna be a pimp," meaning pimping economics.
Right.
But she was thinking pimping
Right. Women.
women.
Sure.
But that's not what he meant. He meant the society, economics, because he was thinking on a different level.
Right.
And so she was touching, and he asked her, "Please don't touch me." He said, "Before I knew, I slapped her in the mouth."
Wow.
Just like that. And then, of course, all the young men in the lunchroom, came after him. They said he was a drug addict, he was on dope, and they took him to Fulton County Jail
Oh man.
in the psych unit where he was abused there too. So he has a story, made it out of that. Private, it's different. I have to say, the facilities in Georgia are different, and I don't want to down anyone from Georgia, but me being a registered nurse and having done psych and worked with patients and their families, because it's not just the patient, it's also the family. It's a joint effort to get that person well again. And then to be in Texas and talk to a staff member in Georgia, and I'm talking about my child, and you're telling me I never spoke to you before, although you clearly have an African accent.
Right.
Just so that you don't want to be responsible or a part of, because my son was again injured in the ER.
Right.
It just says something to how we how can I say, how we help our fellow man, what we're supposed to do just for humanity's sake. And I feel like when someone is ill, they're at their lowest point.
Right.
And especially in the family not knowing what's going on, you're supposed to be there as a nurse, as a doctor. Excuse me, I'm sorry.
It's okay.
To help them, to get better, to become the best that they can become. I'm sorry, I'm getting a little emotional.
No, it's fine. It's fine. It's fine. Now let me ask you this, because when you're talking about that, does that fall under the Hippocratic? Is it Hippocratic oath and
Hippocratic oath, the first do no harm.
right?
And that should be with anyone.
Right.
You don't intentionally try to harm someone or cover things up because you're inadequate.
Right.
If you're not adequate, if that's something, what you're doing is outside of your scope, say it's outside of your scope. Don't be so proud, and puffed up that you can't say, I don't understand what's going on. I don't know what to do.
Right.
Call it and say it so someone else can come in and help you.
Or be dismissive toward that person and their plight. And yeah, absolutely. I will touch on something real quick. It is a shame that, before all of this, that your son was fine and the violence is what initiated all of this.
Yes.
And I hate that he went through that. I hate that you had to go through that. I believe that there is some kind of silver lining we can find in this. And that is the things that you learn, the things that he's learned, what we're addressing now, the people that are listening and actually are going through some of these things that don't want to talk about it, to see someone brave enough to bring this up. But what I want to talk about was the fact that I am from Georgia. I don't feel any kind of way about this, by what you're saying about Georgia. You know the reason why? I used to get all type of speeding tickets when I was in Georgia. I had to deal with all kind of racist cops when I was in Georgia. I haven't had a speeding ticket since I've been here. You know what I mean? Wow. And people would think, oh man, you walk around all these white people and it's going to be this. And so and I'm like, I don't have those experiences that y'all think. I had those more experiences back home in Georgia. So when you tell me that, hey, Georgia is handling things like this, I can believe it because of my personal experiences. And that's my home state. And Georgia is always on my mind. I will always love it. But you have to call a spade a spade.
Yeah.
Right? You have to tell it like it is, and that's just what it is. And my experience has been so much better while I've been here in Texas. So yeah, I mean, I appreciate you bringing that up because you've had that experience. I mean, you've been in California, you've been in Texas, you've been in Georgia. You can talk about these different experiences across these state lines and everything. And I think that's super important. So let's find out where we are with Raw now. Now, he has 3.8 GPA. What is he doing currently right now?
Currently, he's with me.
Okay.
He's working as an assistant manager at a pizza place. And that's because he, during all of this, he's had a couple of breaks. He's not real good with his medication.
Okay.
And that's a lot of the problem is because of his intelligence level and because he has a degree in psychology. Whenever something happened and I called the mental health sheriffs, he was able to outthink them. Wow. He was able to outdo the exams the little mini exams that they gave on site.
Sure.
And so when you have a child or a person that has a high IQ, and that's degree, the mental health system fails them. They're in this gray area.
It sounds like they're not prepared for someone like
They're
that.
not,
Yeah.
because they figure everyone is bumbling and they're
Sure.
out of their mind. But I mean, he's on point. There's a lot of things that he does know, like he's able to get a job, he's able to drive a car, he's able to hold a conversation. But then there's those moments where, he gets a little lost, and that's when I step in.
I got you.
To
balance him out a little bit.
maneuver and say, what
Sure.
you doing, what you say,
Right.
Things like that.
Right.
But then for the medical community, they have to understand that it's not all cookie cutter. Everybody's not the same.
Exactly.
That there should be some programs available for people that are like that, that have, that are college educated, that have these high IQs. They still need the services.
Absolutely.
They still need to be on the medication, although they figure that they don't because they know that every ingredient in there can make you impotent, can make you, delusional, because they know how to research everything to the minutia.
Sure.
And a lot of times that's the hard part. That's the difficult part because they won't adhere to their prescriptions and medical regime because they know so much, too much.
For their own good, right?
Yes.
Here's what I'm going to say. I'm very grateful to God that he did what he did for you, and I'm going to tell you what I'm talking about. There are people who've gone through some of the things you're going through, but they don't have a background in nursing, right? So they don't know. But you were blessed to have this information to know, I don't know about that medication, that medication you're taking, or I don't, maybe you shouldn't be doing this. Are you able to identify certain traits or so forth and so on? So that's the blessing. When I'm talking about the silver lining, that's the blessing for you because you get a chance to pinpoint some of these things to know, like, no, baby, you don't need that, or you can do, you understand what I'm saying? So that is what I'm grateful to God for you personally, for you and your son. You know what I mean? And Raw, if you're listening, Okay, this is the moment where you have to be thankful to God as well for you have a mother this intelligent, this well educated to help you along with what you're doing. You know, because regardless of wherever he's assistant manager at, he's an assistant manager.
That's right.
You understand what I'm saying?
Yeah.
You know, and that's not a slight on anybody who's out there. You can be collecting garbage. You have a job. You're making money. You're doing you're doing something legal. More power to you. But what I'm saying is to rise above just that average level and go above or whatever. If let's just say if he went out and an assistant manager is the highest level he got to, that's still higher than some people. You see what I'm saying? You know, so it wasn't a tragedy. It didn't end, you know, like in the worst situation and everything like that. So, you know, I'm just want to put that out there because people have so many stigmas with these labels and all that stuff there. You know what I mean? And I just don't care. I mean, everyone has a purpose. Like I'm talking about with the trash collector. If every trash, garbage man, whatever, stopped picking up trash right now, you know how our world would look. You know what I'm saying? So everybody has a purpose. So don't look down on anyone just because they collect trash or whatever. You know what I'm saying? So,
Yes.
so I just want to throw that out there, and I want to throw that out there to you, Raw, as well. That if you're listening, and it's not how you start off the race, it's how you end it.
Amen.
So your story is not over with, Raw. You understand what I'm saying? So, okay, so this is where you are with Raw, and I know you mentioned your other children as well. Do you want to tap in a little bit to some other things going? We not talking about the spoiled one. You just spoiled. That's not a
You just spoiled, you know.
we got some ways for that too now. All right, but
The other kids, they're doing their because being that I was a single parent, I required that they either go to university or get a job because I was not going to take care of them. So they're all holding their own.
Black mama.
My oldest boy has his children. He has a job. He decided to work. My two girls, one works for the state. She's doing very well. The other girl is in Georgia at Georgia Tech.
okay, that's what's
she's out
up.
there,
I'm
with
loving
her
all this
dad.
Georgia stuff right now. I'm just saying though.
She's out there with her dad, and she's doing her own thing. And then, of course, like I said, you know, Ra in the middle. He's coming up because we're not going to give up on him.
Absolutely.
And then the baby, who I'm going to say is Tracy, he has his degree in movie production.
Oh,
And so
wow.
He's kind of like, he should be in a movie. But
That's what's up.
right now, he's holding down a full-time job, taking care of himself. And that's what I required.
Right.
So that they all were self-sufficient. So I didn't have to take care of them when they
That's
became
right. That's as you shouldn't.
Because it's my time to do some things for me.
Hey, mama got a life too.
They don't believe that. They don't believe it.
Okay. Now you left off with the experience that Raw had. So did that kind of they put it on his record?
They did.
They did.
They did.
Yeah, so that's unfortunate.
With the the things that he went for 180 days were just for basic criminal trespassing. 'Cause at the time, he was just not well and couldn't stay with any of us, and so they picked him up. And actually, the first time I prayed that my son would be, you know, keep him safe because it was cold. It was December. I couldn't do anything with him at that time, and they picked him up. But what I didn't know is that when they deemed him mentally incompetent, we couldn't bail him out.
Really?
And he had to sit. And I'm going to say this so everybody knows. I don't think a lot of people know. He was in the the medical unit, but he was in solitary confinement. He sat in there for 23 hours a day, 23 hours, 30 minutes to come out only. Kept the light would stay on 24 hours. And I'm thinking, he's not on death row. He didn't kill anybody.
I'm gonna say right.
And also, I would try to send books, and they said reading is a privilege. I didn't understand that. He's an avid reader.
Wow.
And I felt that if he had books, because he liked chemistry and physics and things
Right.
like that, that would help him keep his mind straight. He's a chess player.
Right.
But they didn't allow that. You know, they said
Treat him like he's on death row or something, or
worse.
you know, like a POW or something like.
Well, I guess also because of the fact that when they're mentally ill, if something happens to them, who's going to believe it?
Exactly.
But see, I was always there calling, and I couldn't get in, but I would go to the Attorney General here in Round Rock and Wilco,
Right.
Williamson County.
Oh,
I would go and
y'all know about that Wilco.
Yeah, they know. And so I would go and I would sit in his office and say, hey, why isn't he even at the state hospital? Well, he doesn't meet criteria. Well, how do you know if I'm texting him, because they're allowed to do text messages, and I'm seeing all of this bizarre behavior, these accusations? Oh, well, we don't get into that. We can't read that. Well, you're over the whole program.
Right.
You should be looking at this because he does in fact qualify.
Right.
So there's a lot of hit and miss with, mental health, especially with the jail system, but they have a new program, and it's for recidivism. I forgot what it's called. They just started it so that people that are mentally ill, if they qualify, they're pulled out of that solitary confinement, and they're still in jail, but they're in a different system where they have counselors and they have people to talk to him.
Right.
And I pressed, and the second time he went in for criminal trespassing, he was sleeping in a house that they were refurbishing, but he didn't know, and they took him to jail. Another 180 days, and
Wow.
they put him in the program. Man, when he came out this time, it was different. It was a little different. That's why he's at home as opposed to being homeless.
Right.
So I had written a thing. I have a picture of him in his Morehouse jacket holding a bottle, because I think they get their jacket in their sophomore year.
Okay.
And I wrote something that I was going to present. I sent things out to everybody, especially folks at Morehouse. And it said from Morehouse to the jailhouse to something like that. Young black, I can't think of it. I have to tell you later.
Fine.
But it's basically young black leaders. There's so many young black men and women who have mental illness that are just shoved, brushed under the carpet.
Right.
No one advocates for them. The family just don't have the energy. It is exhausting,
I can imagine.
and it affects. Like, I'm affected by it. There's so many things I don't remember.
Right.
Because it's like you're bombarded with all of these things. You get a phone call. Oh my gosh, what's going on? The police is at your door again.
Right.
What else can happen?
Right.
So you don't rest.
Now this is along with you dealing with your own personal things in your life.
Yes.
Having to work, pay bills, just everyday life. Yeah.
Police up the other kid, but they're adults. But just
course.
all of that, and it's just, I don't know. Like, I was preparing for this, and I was doing a timeline, and I had to call my youngest and say, do you remember I had to talk to the dean at Morehouse so that Rock could even come on to participate, because he had barred him. And I went to this dean and I said, he's a Morehouse man.
Right.
Are you saying he can't come on campus unless the police has been notified for Georgia, that area? And he said, it's just a precautionary measure. I said, well, do y'all have programs to kind of slowly bring these people back in? I mean, he's not a criminal. He just has a mental illness. So there was, nothing happened of it. But I did have to, I asked for an audience with that dean, and he heard what I had to say.
Right.
Because I felt like I would be doing a disservice to my son if I didn't go up there and look in his face and say what I needed to say as his mother. And he thanked me for doing it.
I was going to say that, before that happened, there was no protocols. There were nothing in place, probably, for that. And then the conversation starts people to brainstorming and saying, you know what? Someone else may go through this. We need to have something in place just in case. You know what I mean? So that's why I say it's unfortunate that it had to be you, but who knows what you helped them implement into their program for someone to come later so they don't have the same struggles as you did.
True. Something to think about. I mean, because it happens. It's not just, it happens to every walk of life. Nobody can get away from a mental illness.
Right.
It just happens.
Right.
It's just the money thing.
Right.
Whether you can get someone to have inpatient care or outpatient care.
Right.
And normally, when you don't have a lot of money, you get the outpatient.
Oh, without a doubt.
You get that, and
Yeah.
that's no good. They keep you for 7 days. We all know that it takes about 6 weeks for any type of medication to take. So they're in 7 days. Sometimes they can say 3, and right when they're turning the corner, discharge, and they're not going to follow it.
Wow.
And then you're back to square one. So,
Man.
sorry.
It's just deep, and that's what we have you here for, to start the conversation, to open some eyes, to get some brains thinking, because we don't think about it. If you're not going through it personally, you don't think about that stuff. You know what I mean? The same way, let's just say then if you buy a car, right? And then all of a sudden now you're like, why am I seeing this car everywhere now? No, I never saw this car before.
And I can't think of what that phenomenon
Right?
is. Yes.
But this now will have people a little bit more aware and to think about it, Speaking of that, what I wanted to do was I wanted to get into terminologies, and labels and so forth and so on. It's something that we're going to touch later on into the movie review. But at a certain point in time back in the day, everyone was just known as, oh, that he's retarded. That was it, right? I mean, that was just the label. That was before they broke it all down into these different terminologies. Say, no, this is that, and this is in that category. If you were not normal, you were retarded, right? So can you help us understand what some of these terminologies are? Can you help us put certain things in categories?
I can try.
Okay.
It's been a while.
Oh, it's fine. No, hey, let's dust it off. We're gonna dust it off. We're gonna get that 4.0 back up in here. So, okay. Now, with your son, what he's going through, what is that categorized as?
His diagnosis,
Yes.
what they would say. They're saying that it's schizophrenia with bipolar features. I'm not quite sure what it is on the DSM-5. I should have brought a book. But
that's fine.
yeah.
And so when you talk about bipolar, because bipolar gets thrown around a lot nowadays, right? And I don't know if everyone is if they should be having that label. Someone might just get mad at someone like, oh, he's bipolar or whatever, right? You know what I'm saying? So what is bipolar to you? Like, what is that?
To me, it's a fluctuation of, it's like a mood changes. Like you can have someone they become very depressed or they become very manic. And it's just a fluctuation in the moods. Now, I'm not an expert and it's been a while, people. Okay. So I might not be hitting it on the point, but this is just my interpretation of it, in my experience. So when someone say you're bipolar, they mean, oh God, they're gonna be mood swinging back and forth.
Right. Right. I mean, I'm a Gemini, so they say they might well say I'm bipolar. Like,
Two of you.
You know what I mean? See what I'm saying? So the schizophrenia. Can you touch on that a little bit?
Yeah, that is when a person may have auditory, they hear things, and they have active visual hallucination. They see entities, they see people, they see shapes that communicate with them. Some of them may have tactile. They might feel like something's crawling on them or touching on them. But mostly, like in this case, he, I'm gonna call him out, grandiose features. Like he is going back to school, but he wants to go back to get his engineering, which is something that was, he was slated to do. But then the grandiose comes in as I can go to school, but I don't have to have a plan. I'm just going to walk up in there and do it,
Gotcha.
because I can do that,
Right.
Let's see what else. Basically, with my experience with him, that's what that is. Not so much the violence. We did have an episode way back when, and it was very odd that he came at me. But
Really?
yes, I remember December 16th, 2019. He thought he was going to jump on me, as we say. And I know coming from where I come from, if anybody knows Northern California, I come from North Richmond, Linoleum.
Okay, I've heard of it.
I was a schoolgirl, but then I still held my own. And I remember when he approached me, and what popped in my head is, I'm going to have to fight this ninja.
Right.
Sorry.
And when you say ninja, y'all know what we talking about, right?
And then it was on, and I think it might have shocked him.
Wow.
Because I did what I used to do
Right.
to defend myself.
Right.
But it was ironic that before that happened, there was a UT student, and that happened maybe about the 6th or the 7th of December. And he was an African kid, and he was having some issues, and he actually murdered his mother.
Oh my
So
God.
it came down. That was a big thing for UT at that time. And then for me to have my experience. And also that was a case where they were trying to get help. The programs are out there, everyone. It's just that I'm not gonna bash them, because they're there and they do work.
Sure.
If you can get into the right program and if you can get the right people to hear you. But some of the programs is so many people that are mentally ill that you'll get a call and they'll say, yes, we'll get back with you. And you have all this hope. Well, they got these programs, and then no one calls back. Or they'll give you a number to call, and you call the number, and then it goes to the voicemail. Or they'll say, call the crisis hotline. Okay, crisis hotline, I'm calling you. Well, we need to talk to the person. Well, the person is down the street, they buck naked, and they talking to somebody. They're not going to talk to you.
Right.
I'm calling because I need help. I need
Right.
somebody to come out.
Right.
Well, we can't do that unless we talk to that person.
What?
Yeah, that's real talk.
That's crazy.
They will not take your word Although you're calling for help.
Right.
They want to talk to the ill person who does not have the capability to talk to you. I mean, to ask for help because they feel like they don't need the help.
Right.
You know?
Wow.
So it's a vicious circle. But I don't want to say that to say, don't go to the programs, don't try to seek help. But it's difficult. They need them.
Just temper your expectations. Know that it may not turn out the way that you think it will.
Right.
However, you still do need to make the call.
Make the call. We have Blue Bonnet here in Round Rock. I'm not sure what they have in Travis County.
So what is Blue Bonnet?
Sorry. It's for mental health, mental retardation. It's programs like folks that don't have like insurance. You go there and they can give you services. You can see a doctor. You can get the mental health medication and the counseling and everything. Okay. It's really a great program. But for a crisis type intervention, the best they can do for you is maybe help you get the person into one of the hospitals that's around here.
Right.
And that person will stay maybe 7 days, maybe 2 weeks. No insurance, you're in and out. With insurance, maybe 2 weeks, maybe 3 weeks if you can push it. But like I said, it takes up to 6 weeks for the medication to catch.
Right.
For it to start working in your system appropriately. And then after that, at 3 weeks, they're turning a corner, but then they're back out on the streets. So we need more funding. We definitely need more funding,
right.
Especially for us people of color.
Right.
Because there is a medical disparity. There are others that get more help than people of color.
Of course.
I've seen it. I've worked through it. It's true. And it's sad because we all need help.
Yes.
Yes.
And so I want to touch on these medications that you have kind of referenced. What are the ones that you've experienced having to give your son or him taken? And what are your experiences with it as far as, do you think that it helped? I know you said that it takes, 6 weeks for them to even kick in. Mm-hmm. Are there medications that you feel like he should have stayed away from?
The medication regime that he had in Georgia, because I know he was at one point, they put him in the state hospital before he came back to Texas. And they had him on a combination of lithium, which is an antipsychotic, and then of course cogentin, which is to help the side effects. And then for any behavior, there was the Ativan injections and things like that, and also the Haldol and Depakote for mood swings and things like that. They just had him on a really heavy cocktail where he was more or less like a zombie, and that's what you don't want. And as a parent, as a caregiver, as an advocate, you want to know the medications that your person is on, because especially, I'm so sorry I have to say it, people of color, because sometimes we talk loud, we talk with our hands. Sure. And as a nurse, I saw this. Sure. And working at the state hospital, when we would have a patient, may I tell a quick story? Do you have time for me to tell?
We got all the time that you need. Okay,
there was a young boy who was at UT, and he went, I could see his face, but I can't, young black boy. And so he was at UT, and he had to go to summer school. So he went to a party and was kicking it with everybody, having a good time. Somebody slipped him I don't know what they call it now, but we called it a Mickey.
It was a Mickey, roofies.
A roofie.
All that.
So he got buck wild. They called the police. He kicked the door off the car. Big old stout boy, pretty boy, just really good kid after a while. And so they brought him in. I'm the only nurse on the unit. I'm about itty bitty back then. And so they brought him in. He was in the chair where they strap you to the chair and they put the mask over your head because he was kicking the skin.
Wow.
So they bring him here and they're like, well, he's yours now. So I'm looking. I got maybe one male staff. And then so I'm thinking, what can I do? I'm like, okay, I'm going to be mama. That's what I'm going to do. Right. So I took the hood off of him and he blowing and stuff. And so they unstrap him and he's in the corner. And I said, what are you in here for? And he all upset. I said, let me tell you something. Your parents sent you off to go to school, and that's what you're supposed to do. Now, you in here, and these people going to keep you. If you don't follow the medication plan that they have, the care plan. Right. I said, you don't want to stay in here, young man. I said, so I would advise you to take the medication, go to the counseling, and get on out of here. And he did it.
Really?
He did that. Yes, he did. And he came back and talked to me and said, thank you, Nurse McClain, thank you. And I said, yeah, because whoever done that to you, they're not your friend.
Wow.
They just wanted to see you. You're up and coming.
Right.
I cannot think of his name.
They were probably jealous.
Jealous, up and coming, because your so-called friends are your worst friends sometimes,
Absolutely.
all the time.
Right.
And so he got out of there, and I never seen him again.
Wow.
And that's just one of those success stories where I say somebody will come into the hospital and they'll be all jumped up. They don't understand. They're all doing all type of things, and once they get the correct medication, they'll flourish. They'll turn into who they're supposed to be. That person that everybody knew and loved before the mental illness or whatever, the drug-induced psychosis happened.
Right.
Yeah.
And I'm gonna tell you what I'm picking up from here, because it sounds like the right medication. If y'all didn't hear what I just heard, sounds like Black Mama. It comes in a bottle. You can get it at your local grocery store. You got any problems? Call Black Mama, and she'll straighten it right on out. I'm sorry. Y'all know how we do around here. So, I know we're coming toward the end of this. I want to ask something else, because there is an epidemic that has been going on lately, and I know you've heard of it. Fentanyl.
Oh, my word.
Fentanyl.
I have a personal experience with that one.
So I wanted to touch on that, because that is something you hear it almost every other day. I mean, we've lost so many actors and musicians and friends and all that to fentanyl, and for some reason people don't seem to get it yet. You know what I mean? And they're still taking these pills, they're still doing all this stuff, and it's like, come on, do you not want to live? Or what is the deal? So what do you have to say about that, Miss Tracy?
It only takes one. Now, I had a back surgery. Well, I had a neck. The thing that ended my career was a hit and run accident. And so I'm fused from C4 to C7. And I had improper fusion or something like that. So every now and then I still have to take pain medication. And my doctor decided to give me fentanyl. And I tell you what, I'll never want to see that. I thought I had a snake going down my throat. I was calling the police.
Oh my
I
God.
thought people were beating on the wall, and I mean, it was horrible. So today, these not even young people, old people, they think only one pill can take your life, depending on your body weight, depending on if you're hydrated, how your kidneys are working. It's not just one pill.
Right.
It can kill you. And then also, I understand what they're doing now is that whatever's coming from the other Mexico or whatever.
Sure.
It's being crushed up and put into the street drugs. A lot of people are dropping. Fentanyl was supposedly put on the market for people that had severe pain, and also people that cancer patient.
Right.
And then as I think end of life medication for people in a lot of pain, not for everyday use.
Right.
And some of these doctors will just give it out. They just give it. I don't know. I just have to, just my personal experience. I just think it should stay where it should have stayed, and that's for people that are terminally ill,
right,
and cancer patients, not just for, severe pain. I have severe pain, but I would never take that again, ever, because it is a killer. It's a life ender, the fentanyl.
Yeah, for people that like to experiment with drugs and so forth and so on, listen, it's your life. You do what you do, but it hardly ever ends well. You know what I mean? Like, you hardly hear any success story about, oh yeah, I smoked crack, I did this and such. That right there reminds me of back in the day. I remember when I first came to Texas. It was back in '96 and whatever. And I remember this guy approached me, and he was like, hey man, you should try this, man. It's called some wet. Like, some wet. What are you talking about? And so I would ask somebody, I was like, what is he talking about? Oh, nah, man, you don't want that, man. They dip that in formaldehyde and all this. I'm like, come on, yo. And it's funny because you could smell it. Like, why would you want to do that? You know what I mean? Like, why would you want to put that in your body? You know what I mean? Like, they put that into people who are no longer living. You're living. Why would you want to put that in your body? So this just reminds me of that, because, like I said, even though it's such an epidemic, people are still doing it. They're still popping pills. You take a pill, you can't see what's inside that pill. You just see the pill and you take it, and whatever happens is what happens. So it's just amazing to me that people still are taking those chances with their lives.
And if I can interject, they're pressing pills. They have pill pressers. They do that. And when you said that wet, it's also called buck naked. And it's called buck naked because, your body just feels like it's on fire. So you want to take off all your clothes and run down the street.
Wow. Oh, my
Who
gosh.
was that? So yeah.
Like Smokey and the Chicken Coop.
That's it. Yep.
Well, before we wrap this up, I know, first of all, let me ask you, you mind sticking around and reviewing this radio with us?
Oh, I'd love to.
Oh,
Yes.
Absolutely. All right. So wrapping that up, do you have anything you would like to leave our audience with?
I just like to tell the community, everyone, that we all have to be community. When you have someone that's mentally ill, any type of illness, come together as a family, as friends, and support that person, support the parents, because it's tough.
Right.
It's tough, and the main thing, and it might sound a little like this might sound kind of hokey, but don't give up hope.
Right.
Do not give up hope. Don't fall into despair because you can't go anywhere. You know, I'm not trying to rap or nothing like that.
Sure, that's
but
right.
You can't go anywhere if you fall into that deep depths of despair. I've been there, and I've had to pull myself up and say, hey, tomorrow is going to be another day. Tomorrow is going to be a better day. But my child is depending on me, and I just can't give up. And I won't.
That's right.
I'm a little bit obsessive compulsive. So I won't give up on him because you know what? You got to get that 4.0.
You only got 2 more points, bro. 2 more, bro. You can push through, man. You got this, yo. You got this, all right? Mama she laid the groundwork for you, you know what I'm saying? You know? No, that's awesome. And that is what people don't have a lot of these days, hope. It's not, it's not celebrated. It's not pushed out into the narrative to have hope. Actually the opposite, just give on up. And
No.
our attention spans are so short now. We don't care about anything. If it's not on our phone, we don't even look up to see what's going on. Some things could be going on right in front of us, but we don't care because if it's not on our phone, we're not even paying attention to it. So just to have someone come in and say things like that, and hey, don't give up, because I guarantee you somebody that's listening, and I'm talking about you, the person that's listening right now, you're going through it, but you don't want to share it. You might be a little afraid and everything like that. But if you listen to this brave woman right now, she just shared a lot of her personal experiences. Okay. So you can do the same thing. But if you don't want to do that, if you don't want to come on a podcast and share it, then you can absolutely contact us, hit us on the comments, you know what I'm saying, and we can reach out to you. I'm pretty sure Ms. McClain wouldn't mind having someone to share these things with personally and help someone through their struggles as well.
I love it. I would love to do it to help because
Yeah.
we all helping each other at the same time, you know?
You said community. And community is not just we're not talking about just black people, white people, Indians, Asians, Hispanics, everybody. We're all community because we're all on this earth together. All right. So don't forget that. The things that she's pointing out, things that I point out are just the truth about, the black community and the things that we do. I will say this, and I've said this before. I do envy quite a few other races when it comes to the way that they come over to the country. They will all live in the same house, drive the same car, and do all that until they come up, and then they all spread out and they got their own businesses and so forth and so on. We don't do that. We tend to tear each other down. You know what I mean? Like she said, with jealousy and things that were implemented a long time ago in slavery when people knew they couldn't physically enslave us anymore and they had to mentally enslave us. And so for some reason, we're continuing to fall for the banana in the tailpipe. Okay. That's a reference to our last review. Go out and check out that Axel F. Beverly Hills Cop. But it's something that we have to do something about, guys. You know what I mean? And it's conversations like this that help brings that to the forefront. So, Ms. Tracy.
Yes, sir.
I want to thank you so much for coming on and sharing your story on this part. You said you're going to stick around for the review, but definitely sharing this. This was very brave of you.
Thank you, Mr. Bryce. I appreciate it.
What I want to ask you right now, and I'm gonna put you on the spot. So mental health awareness is in March, May.
I'm
May.
not sure.
It's May.
Sorry.
Yes, it's May because it was same month as Mother's Day. How would you feel about coming back on next May 2025 and maybe updating on us where Raw is? Because I mean, you've told us about us now. I mean, we're locked in with you. We want to kind of know where his journey is.
I'd love to do it.
Love to see if you get that 4.0. You see what I just did there? I put a little pressure on you.
I'd love to. And I thank y'all for having me. I really appreciate it.
Absolutely. Absolutely. All right, guys. Well, y'all stick around because we will be right back with the review of Radio. I know y'all know that movie. Classic. Cuba Gooding, Ed Harris. So if y'all stick around, we will be right back after these messages.